Rowe Dental Laboratory. We are very excited about our Passivity Plus technology and our Passivity Plus coping, which is a self-adjusting coping that is cemented into your final zirconia, and as you seat it, it self-adjusts onto the multi-unit abutment. Very cool technology, and we have a lot of different videos out there explaining how great of a product this really is and what application to use it. But in this video, we're going to kind of break down the components of the Passivity Plus coping. This is a very unique coping, and I do want to mention that this coping is inserted into the final prosthesis without a model. So this is a model-free workflow. We're going to go into a little bit of the componentry of the coping itself, because we've really been getting questions as to how does the actual coping work? Like, what makes it work? How does it adjust onto the MUA so it's an accurate passive seat and even seat across the multi-unit abutment? These Passivity Plus copings, they're not just a workaround to a non-passive situation. These are a precision engineered prosthetic component that is inserted into your final zirconia. So how does this work? Well, it's made up of 4 components within the coping itself. The first component is really just the base. The base of it seats onto the multi-unit abutment. Next, we have the pivotable cap. Now, the pivotable self-adjusting cap, that's what will kind of move as you go and seat the prosthesis down onto each multi-unit abutment, helping to put it in the most passive position. Now, what's screwing this all together is going to be a tapered screw. So this tapered screw, it's a self-centering screw. So again, this is going to help even everything out as it screws down. There's one final thing we haven't talked about that brings all of this technology together and allows for an even seat onto that multi-unit abutment. And that is the patented washer that's built into the coping itself. And as that screw adjusts, the washer is also adjusting. So now it's self-centering, and it will self-center itself evenly and put even pressure along the base of that multi-unit abutment for a nice even seat all the way across the arch. If you have any questions about Passivity Plus and how these parts all work together, we have an awesome FAQ on our website. We have a great Passivity Plus page built out that really goes into the hows and the whys of Passivity Plus, and some awesome videos as well that kind of show the technology working no matter what your workflow is. No matter the data acquisition, it's all the same on your end. You have to do nothing different to submit that to us, and we can insert the Passivity Plus copings into your final zirconia. We can't wait to work with you on your next final zirconia and insert our Passivity Plus coping to give you the most passive seat across the arch and have that patient leave your office smiling with their brand new teeth.